segment 2, fixing it. You're calling for 3 fundamental reforms. One for Medicare, one for Medicaid, one for working Americans. Let's just take each one in turn. Medicare, the system that covers all Americans 65 and over. Quoting from remarks that you're going to deliver here in California later today, you may ad-lib for all I know, but this is the way it reads in paper. Quote, in Medicare, patient-centered reform means premium support, close quote. Give me both of those. What's patient-centered reform, and why does it require premium support?
Patient-centered means the patient is the nucleus of the healthcare system, not the government, not the insurance bureaucrat. So with the patient-centered, that means all providers are competing against each other for the patient's business. Hospitals, doctors, insurance companies forced into competition with one another for the person's benefit. Wherever we've tried this dynamic in the free economy, it's worked very, very well to bring down costs and increase quality. And this has also worked this way well in healthcare, in Medicare. The Part D benefit. People complain about how Part D got assembled.
Which is the prescription
drug benefit involves patient-centered. These are plans that are forced to compete against each other, and people get to choose among competing plans.
And that has cost less than
it's cost 41% less than projected, and it's very high in satisfaction. Premium support means you'll have a list of guaranteed coverage options offered to you through Medicare, just like I as a member of Congress have as a federal employee, just like Medicare Advantage works for 20% of seniors. The senior chooses among the list of these guaranteed coverage options, and these plans compete against each other for their business. If the senior doesn't like her plan this year, she can fire it and go to another plan next year, and Medicare subsidizes the portion of her premium based on who she is. Is she sick or poor or middle income? She'll get a lot more of a subsidy. If she's a wealthy, healthy person, she won't get as much of a subsidy. And doing it that way, according to the Clinton Commission, according to a lot of other Democrats, according to the actuaries at HHS, makes the program solvent and sustainable. So this is an idea that has historically had bipartisan support among, I guess I'd say, more moderate Democrats. It's an idea that we put in our Path to Prosperity budget, and it's a way of saving Medicare. And the other part of it is you don't have to do this, put these kinds of reforms into the current generation. If you act now, you can prevent any change from a person 55 and above, and so it applies to those of us who are 54 and below. And I would simply argue, let's preempt a European austerity where we're cutting current seniors, raising taxes. Let's phase in reforms that are gradual, that have proven to work, that actually save the system and prevent the country from going off a debt cliff.
Okay. According to the Congressional Budget Office, 10 years after the enactment of your reform, the federal government would be spending $240 billion less per year on Medicare than it would under current law. How do they know that?
So,
I mean, you get. I
can get into the spreadsheet if you want.
If you say to me, I want to make this more, I want to take Medicare and do everything I can to make it look more like a market.
Right.
I say, great.
Yeah.
Everything I know about life and American history suggests that will help and save money.
Here's how.
But how do we know? Okay.
Here's how. Because it's going from a defined, open-ended defined benefit system to a defined contribution system. And because these are defined contributions, they're quantifiable. You can, how many people are going into Medicare, how much of the contribution. President Obama's law does the similar kind of thing, except he caps it globally and runs it from government. So President Obama is taking Medicare spending from here down to there. He's proposing a complicated formula, and then he's giving a board of 15 unelected bureaucrats called the Independent Payment Advisory Board the power to price control Medicare to lower those costs, to get those savings. So here's the difference. We are saying run the money through the individual based on their need so that they have the power to decide how their health care will be delivered to them, and you can chart those costs. The president is saying cap those costs as well, cut Medicare from its current growth rates, but give the power to 15 unelected bureaucrats to decide who gets what, when, where, and how. Very different approaches. Both of them recognize that Medicare is growing at an unsustainable rate. We say, let's do it through choice and competition revolving around the beneficiary, the patient. He says, I want these 15 bureaucrats I'm appointing next year to make all the decisions. So no one is suggesting Medicare can grow at the rate that it's growing at. That has a $37 trillion unfunded liability.
Even President Obama
is suggesting that has to change. The difference is he wants unelected bureaucrats to make the shots. That we want patients to make the decisions.
Okay. Back to the weekly standard. Is UV 11 a friend as well?
Yeah.
Okay, good. So again, who knows? Maybe you've already read this, or for all I know,
I've read Capretta's. He sent it over.
Okay, so UV 11 in the current issue of the Weekly Standard, your reform gets attacked from the right. I imagine that's a novel experience.
I've heard it all.
Have you heard it all?
I've heard everything from everybody.
Okay, so here's you. But he makes the point that under your reform proposal, it is still the government that is establishing the floor benefit.
That's right.
Minimum benefit.
Right.
Okay. And he says, You've 11 has a better idea. Have a better idea. And I have to say, as I read the article yesterday, it did sound like a better idea. Forgive me, but it did sound like a better idea. So the notion here is that Medicare, the government should define what it wants, the level of care that it wants as the minimum, go out to each of the Medicare regions and invite bidding, and then choose the second least expensive, second most inexpensive, so to speak, so that on the defined contribution to the 65-year-old, there's always in his or her region one plan that's less expensive, that enables him to put money in his pocket, one plan that just takes every dollar and provides perfectly adequate support, and then an array of plans for which he or she can chip in a little extra.
So that's just an improvement upon our idea. Our idea is our plan doesn't preclude any of that.
No, it doesn't preclude it?
Not at all.
So you have no objection at all?
No, not at all. No, our plan gives you the basic framework of how a premium support system would work, what it would cost, and then when you implement such a system, those are the kinds of details that you grapple with in how to design a very good functioning market-based premium support system. So that's perfectly complementary with what we're talking about.
So you've 11 mere details. Nice idea. We'll discuss it later. Is that correct?
Absolutely.
Okay, fine.